Insights Media.
Good health and well-being is goal 3 of Sustainable Development Goals. Provision of quality health is scheduled with the government as enshrined in the Constitution of Nigeria, especially Section 14. It was on a Sunday afternoon that this reporter visited Comprehensive Healthcare Center located in Konda area of Ilobo, Irekpodun local government area of Osun State. The secondary healthcare facility is located on 6 plots of land. According to this rusted signpost at the entrance, this facility was commissioned in the year 2001 during the administration of Chief B.C. Akonde as the governor of the state. It is the only secondary healthcare facility serving Ilobo, Erin-Osun, some parts of Egbedore, precisely Alakpopo, Atura, Okini, and Ibekunle communities. This reporter was greeted with blown-off roof at the entrance. However, the inner parts of the hospital are worse and more terrible than the outside. Here is a tour of the hospital as conducted by this reporter. Two sections of the hospital, including the delivery ward, have been completely abandoned and probably taken over by wasps as seen flying in these sections. Investigation also revealed that several attempts have been made by the people of Ilobo under the aegis of Ilobo Asake Development Union to get the attention of the state government to the facility, but all proved abortive. The same efforts have also been made by past staff of the hospital who have, as one way or the other, requested to leave after the facility remained the same. Some residents of the area who were interviewed by this reporter decried the state of the facility and called on the government to find solution to it as it's affecting their state of health and well-being.
Tẹ́lẹ̀tẹ́lẹ̀ òṣìṣẹ́ pọ̀ ńbẹ̀ wọ́n sì ń ṣiṣẹ́ regularly tó ṣe wípé iníṣẹ́ ọ̀sán wà iníṣẹ́ àárọ̀ wà iníṣẹ́ alẹ́ wà ṣùgbọ́n ní ìsìn ó ti dọ́ọ̀lù kò sí òṣìṣẹ́ kankan mọ́ àwọn òṣìṣẹ́ báyìí ó pẹ́ tán po láago méjì tí wọ́n ti lọ gbogbo àwọn aláboyún tí wọ́n ń bímọ síbì nígbà tí ò ti sí òṣìṣẹ́ mọ́ wọn ò wá mọ́ tààrà.
Ṣé nígbà tí hospital yìí kọ́kọ́ bẹ̀rẹ̀ láyé Govt Bisi Akande so ní gbogbo area yìí kò síbi tí wọn ò ti wá wọn mọ wá ní Ìfọ̀n wọn mọ wá ní Ẹ̀rìn kódà fún gan wọn mọ wá látòṣogbo tí wọn máa ń kóyàn wá síbẹ̀ láti wá gba ìtọ́jú but ìgbà tó yá tí ò sí àwọn maintenance dáadáa níbẹ̀ mọ́ tí ò sí oògùn tí ò sí kankan díẹ̀díẹ̀ àwọn èèyàn ò wá mọ́ bọ̀ kò nínú gbogbo community kò síbi tí wọn ò ti wá bọ̀ wọn ò wá mọ́ dáadáa báyìí.
tó fi jẹ́ pé n ta nídìí ni pé kí ìjọba kó dákun torí Ọlọ́run kí wọ́n bá kó òṣìṣẹ́ wá kó pọ̀ dáadáa kí wọ́n máa tọ́jú wa ká máa gbóògùn gbogbo aláboyún kí wọ́n máa rí oògùn gbà.
According to the information we gather, from this side we have Arinkeke, we have a lot of communities, Arinkeke, Atoyebi, and then when you go to this other side of the community, we are going to be having Amusu, Konda, and some other areas. I was told that we still have an area here that we call Abepe. According to the statistics, raw statistics that was given to us by the people that are living in this area, they said they have over 2,000 households that are, connected to this hospital. I mean, the immediate environment of this hospital. Then when we now want to extend the service of this hospital, it means this hospital is the only secondary facility that we have here, and it will be serving the whole of Ilobo and some part of Erin and even some part of our local government. And I can even say that it should also be serving some part of Egbedo local government, precisely in Okini area of the Egbedo local government. So this hospital is one of the very important facilities, medical facilities in the state. And the people are calling on the government, as we heard them say, they are calling on the government to ensure that they rehabilitate this hospital, equip them and staff it so that it can perform optimally as it was in the early year 2000, 2005, 2010, before it got into this state that it is now. Reacting to this, the special advisor to Governor Ademola Adeleke on public health, Dr. Adekunle Akindele, blamed the past administration for the rots. He said the government will look into the matter and find a way of rehabilitating the facility. Adekunle also said the experience at Kounda CHC is the general overview of what is obtainable in all comprehensive healthcare centers in the state.
And graciously, the executive governor has approved the renovation and upgrade of 345 health centers. Everything that has to be done, documentation about it, have been perfected. I can assure you that in a couple of weeks, a week or thereabout, we start renovating those centers. What I mean by renovation of upgrade is, we discovered that almost all, less than 99% of those centers don't even have electricity. So we're going to put in solar energy there so that they can have 24 hours electricity. Besides that, most of the boreholes that are there are not working, they're not reticulated. What I mean by that is that water is not running within the facilities. We're going to make sure that those ones are fixed. And we're not only stopping there, we're going to put in personnel. It's one of the problems we met on ground. It's appalling that for almost 12 years, no vacancy, no employment was done in those centers. A lot of doctors have left, community extension workers, no nurses there. So we have done a lead assessment, and we are going to gradually employ people to fill in those spaces. For the comprehensive health centers, we have 27. And believe you me, it's the same story everywhere. It's not habitable. We've equally worked on that. We're going to do in phases. After the 345, we're going to take at least 9 of those comprehensive centers, 1 from each federal constituency. We're going to fix it and make it habitable for both patients and doctors. That's medical practitioners that will be working in there. It's not the fault of this government. It's not limited to the health sector alone. Almost everywhere, when you go to roads, schools, they have not been properly attended to. Those are the things we are grappling with. We're undeterred. The governor is so much committed to the health and well-being of general people.
From Ilobu, Jare Tiamiyu, Inside News TV.
Insights Media.